Radio Now 100.9's Indy Connection with Emily Metheny.
Hello, I'm Emily Metheny, your host. The primary elections are coming up soon on June 2nd, but before you head to the polls or send in your mail-in ballots, the registration deadline needs to pass. Monday, May 4th is the deadline to register to vote in the primaries. Jeremy Burton, Chief Deputy for the Marion County Voter Registration, spoke with me to talk about how the elections are looking different this year. Jeremy, can you tell me a little bit about how the election coming up for the primaries has changed since the coronavirus hit?
Sure, Emily. What's going on is because of this virus, the primary has been pushed back to June the 2nd. And folks are being encouraged to vote by mail. It used to be that if you wanted to vote by mail, you had to have an excuse. Now that there's this virus getting us sick, we don't have to have an excuse anymore, at least for this election. So anyone can vote by mail so that fewer voters are at the polls so that we stay healthy. That means any registered voter in Indianapolis can vote by mail for this primary. Our clerk, Mila Eldridge, sends every voter a vote-by-mail application to the address where they're registered. So she and her team are working to make this as easy as possible for voters to vote by mail.
And that is if you're a registered voter in Marion County?
Yes.
And with the mail-in ballots, is that the same as an absentee ballot?
Yes, absolutely. Yep. Same interchangeable terms, absentee ballot, mailing ballot.
And let's say someone just moved and they are no longer a resident of Marion County. How would they go about updating their registration?
If they move somewhere else in Indiana, they can go to indianavoters.in.gov and they can update their registration on that website. That same website allows you also to apply for an absentee by mail ballot online. That way you don't even have to fill out the paper form. You can't. But those who don't have internet, our clerk, Mila Eldridge, has sent out the paper form to every registered voter.
And I know someone who just actually moved out of Marion County.
Okay.
Would he be eligible to vote in this primary, or would he not be able to?
Well, you have until May 4th to register to vote or update your registration for the June 2nd primary. So if he's moved to a different county, he can go to indianavoters.in.gov, update his registration before May 4th, and he could vote in this election. Absolutely.
And it doesn't matter if he hasn't lived in that precinct for 30 days.
So May 4th is 30 days before the June 2nd primary. That's why the deadline to register is May the 4th. Does that make sense?
Perfect. Okay, that makes sense. I just wanted to make sure It wasn't, since he just moved a week ago, it wouldn't, since he will, it's still 30 days. Okay, that makes sense.
He's more than 30 days away, yep.
Perfect. And with the upcoming elections, if someone's not able to send in a mail-in ballot, or they don't make it by the deadline, they can still go to polling locations on June 2nd, right?
That's right. And on indianavoters.in.gov, all the vote centers are listed there for Marion County residents, and they can pick the one that they want and go to any of the locations on Election Day.
And the polls are open from 6 a.m. to 6 p.m.?
Correct.
Because of the coronavirus, will there be more precautions in place for those who are voting at the polls to protect both the voters and the people working at the polls?
Absolutely. Our clerk, Mila Eldridge, is working very hard to make sure she protects her workers and voters that must come in to vote on Election Day. But again, that's why she has sent every voter a mail-in application to encourage voting by mail so that we can all stay safe and have fewer voters on Election Day at the polls.
Excellent.
Yep.
And the deadline to do that is this coming Tuesday. It is May 4th.
It's Monday, May 4th.
Monday, May 4th, sorry.
And, that's right. And you have until 11:59 p.m. to update your registration online at indianavoters.in.gov. And if you print off from that website the application and want to mail it in, as long as it's postmarked on Monday, May 4th, that counts and will be processed, and you can vote in the June 2nd primary.
And I know I've asked this before, but if someone is just hearing this interview, if you are 17 years old, are you able to vote in this upcoming election?
Absolutely, because this is a primary election. If you're going to be 18 years old by the November general election, then you have the right, even if you're 17 now, to cast a ballot in the June 2nd primary.
So they would also need to go to indianavoters.in.gov to do the registration as well.
Correct.
Excellent.
That's right, and they would be processed like any other voter. You know, the general election is on Tuesday, November the 3rd. So if they turn 18 years old on Tuesday, November the 3rd, 2020, then they can register to vote now and be eligible for the June 2nd primary.
Excellent. And before we started talking, you mentioned you've been receiving a lot of questions about the upcoming primary. Is there any questions that you've been getting again and again that you'd like to share?
Sure. If you want to request an absentee ballot, you can do that online at indianavoters.in.gov and submit your application for an absentee ballot online. You absolutely can also use the form that's been mailed to you to mail that in to request an absentee ballot. And if you're not sure if you're registered to vote, you can look on indianavoters.in.gov to see if you're registered. And if you're not, you can also register there. Those are the most common questions, Emily, that we've been getting.
Excellent. And this all needs to be done by Monday, May 4th, to make sure you are ready to go for the primary on June 2nd.
Yes, that's the registration deadline. Now, you have until May 21st to request an absentee ballot. And once you receive your ballot in the mail, after having requested it, you have until noon on Election Day, June 2nd, to make sure that ballot is returned to the Marion County Election Board.
So I could mail it in, or could I drop
Yes.
it off?
Or you could drop it off at the Election Service Center, which is at 3737 East Washington Street in Indianapolis. But when you receive your ballot, there's a return postage paid envelope to return that by mail, so nobody should have to drop it off.
Is there anything else that you'd like to add, Jeremy?
No, thank you, Emily, and thank you for getting the word out that we're encouraging people to vote by mail and go to indianavoters.in.gov to request an absentee ballot and make sure you're registered.
Perfect. Thank you so much, Jeremy.
Thanks, Emily.
COVID-19 is impacting all areas of life, from a voter's booth to your mental health. Dr. Ukamaka Oruche recently spoke with me about how the coronavirus is affecting people's mental health and what people can do to support one another. Dr. Oruche, could you tell me a little bit about how COVID-19 is impacting mental health in the general population?
Yes. So, as you probably may have heard, there's definitely across the nation, including Indiana, Indianapolis, significant upsurge in mental health complaints, including substance abuse. And that is related in part to, all of the stressors associated, with, things like stay-at-home orders, which has led to changes in our work situations, decreased social contact. Many of us are staying indoors in small spaces for long periods of time. And then for many young parents, they're having to do e-learning with their young children as well. So there is marked increased stress. Many people are complaining about lots of anxiety about not knowing quite what to expect with the pandemic and the stay-at-home orders. Could be anxiety related to job security. Some people may have had their hours of work cut down. Some have lost job totally. There's also sadness, right, and grief related to, news of so many lives lost as of today, 54,000 and counting. Some of us may have experienced losses in our own family members or extended family members or larger community. So all of that is really compounding our level of stress and anxiety. And by the way, I want to say stress is not always a bad thing. What happens, however, we get concerned when it's way beyond to the point that is affecting our day-to-day functioning, our day-to-day routine, then we start getting worried. So, and as a consequence, then, we're seeing this upsurge in calls to, say, 211 helpline here in Indianapolis. We're seeing an upsurge in calls for mental health and, of course, for substance abuse issues as well.
And for those who are recovering from substance abuse, how is COVID-19 impacting their recovery and just everything in general?
Yes. So for the subsection of the population that already had existing mental health issues, so they had, all kinds of mental health diagnosis of substance use disorder before COVID-19 pandemic, this is certainly taking a toll. I want to start by saying many of our community mental health centers and primary care centers across the state and Indianapolis have been proactive in terms of helping support patients who are already connected with treatment. So, for example, almost all of them, including Eskenazi Health, which is where I work, have moved patient visits to telephone or televideo for all patients, so that patients will have minimal disruption in their services, whether it's for medication or for counseling. They limited the number of face-to-face appointments and moved them to telephone or televideo, so we can minimize disruption in people's treatment. And that is the same whether it's for mental health or substance abuse. So in that way, we're trying to support people who have existing conditions. Having said that, we know, from the news that patients who are already struggling in these areas have additional or an increase in the severity of their illness. So, for example, I even hate to use this example, but we had a case in the nation. It wasn't here in Indianapolis, but it was a patient who had bipolar disorder and had to stay indoors, be isolated. He lived in an apartment by himself. The isolation of having to stay indoors was just way too much. And unfortunately, that person ended up committing suicide. We certainly don't want that to happen anymore for any of our patients. So there's no question there's added stress for patients who are already struggling with mental illness or substance use. So, so we recognize that. But we as providers are doing the best that we can to stay in touch with our patients.
And for the people who have family members who struggle with mental health and mental illness, with mental health and substance abuse, how can they help their family members, their friends during this?
During this time, yeah. So, I see and I learned clearly a few years ago that we are social beings. We thrive on social connectedness. One of the best things we want to do during this time is to stay connected, whether it's via phone or phone chat, text with our loved ones who are already struggling with mental illness. I would say as a friend, as a family member, check in as frequently as you can on your loved ones, daily. Check in with them and give them permission to call you as they need. Make sure they are connected with their providers and taking their medications as they should. And if you sense that they are having difficulty doing that, please help them to make the necessary connections. When we are stressed, we don't problem solve well. So one of the best things you can do is to talk with your loved ones who may have mental illness or substance use, get a sense of what they're doing in terms of their treatment. If you sense there's some disorganization or not a clear plan, please help them to clearly identify a plan and a step-by-step action on how they stay connected with their healthcare providers and that they are taking their medications as well. As you know, pharmacies are open, so if there's a need to help them get to the pharmacy and get their medications, please help them to facilitate that. So that social connectedness, I think, is the best thing. Connection to family members, connections to support groups, connection to their healthcare providers will be very, very desirable.
And earlier you sent me some resources. Can we talk a little bit about those resources? I know you've mentioned 211 for locally here in Indiana, which will connect you with different organizations who can help connect you with services. What other resources are there?
Yes, so there are a number of other resources. You can call 911, of course, at any time for any type of emergencies. You can call the Disaster Distress Hotline. That number is 1-800-985-5990. You can also text 66746. There is another number that I want to share, and I will tell you why. That number is to the National Domestic Hotline. It's 1-800-799-7233. That number, as you heard, is to the National Domestic Hotline. There is concern, and this is very much part of our mental health or emotional well-being. We know there is an upsurge in the number of domestic violence calls. There's also an upsurge in the number of calls for child abuse or child neglect situations. So please don't be alone. Again, we owe it to one another to listen and help make sure people get the help that they need. So that's why I shared that National Domestic Hotline as well.
And that hotline will help connect for both significant others and for children as well. It's not just one or the other.
Yes, exactly. Mm-hmm. Yes.
And for someone who is communicating with their family, what are some things they can look for if something seems like they need to reach out to the National Domestic Hotline? What things can people be looking for child abuse and domestic abuse?
Yes. So hopefully you get to visualize the child. So if you know, for example, that there were that kinds of history before in a particular family or whatever, or even if there wasn't, I would keep an eye, for example, are you able to maintain contact, say, with the children? Say you call to the home and you may ask to speak with the child or something like that. You make some sort of inquiry about the child. How is Johnny doing? Get Johnny on the phone. If you find that you constantly get pushback or some excuses about why Johnny couldn't get on the phone, that might be a source of concern. If you are on video chat or you happen to maybe visit the home, keep an eye on the children. I know they're not going to school, so they may not always be dressed. They may be running around in their pajamas, so that's normal. But look for, any depressed emotion, any type of wounds that seems really unusual or raises some red flag for you, especially for the children. That would be important. Check to make sure they eat food in the house. Ask about that. Again, that's in the case of children. For adults, listen for any suspiciousness in people's voices. It's not uncommon that for women or even men, for that matter, in domestic violence situations, they may have unusual wounds to the face, arm, where they end up wearing long sleeves. Keep an eye for things like that. That is important. Anything that does not make a lot of sense to you or feels really out of place, gently inquire, and if needed, push a little hard so that you can help support whoever that might be.
And because we are doing the quarantining and the self-isolating, this would be very important to do because people aren't going to work like they typically would, or the kids aren't going to school. So just an extra set of eyes right now, making sure we're staying socially connected.
Yes.
And after COVID-19, after we get through this all together, do you think that there will be a change in the stigma with mental health in general?
I am hopeful. I am absolutely hopeful. I don't think you would remove it, 100%. But I think we have an incredible opportunity. Already there's an acknowledgement and talk about mental health and the impact on not just a sub-segment of the population, but all of us. All of us are under immense stress because of the unusualness of the COVID-19 pandemic. So from that perspective, I'm seeing an increased awareness and a willingness to talk about mental illness. And so it's my hope that as we pass the pandemic, the implication then is reduced stigma, that people will be more open to seeking care. We normalize that. It's okay to seek care for mental illness, just like you would physical illness. And greater support and allocation of resources towards provision of mental health services would be much, much desirable. Telehealth, we're learning, has really changed the way we provide care, not just for physical care, but for the first time for mental health care. And so, we're seeing more people gain access, and those are all steps in the right direction to, decreasing stigma. So I am very helpful. I am very hopeful.
And if someone is looking for resources, you can call 211 if you live in Indiana. You can call the Disaster Distress Hotline at 1-800-985-5990. You can also text to 66746. And if you need help with domestic abuse or violence, you can call the National Domestic Hotline at 1-800-799-7233.
Yes.
Is there anything else you'd like to add?
I want to add in closing, as stressful, totally confusing and perplexing as this pandemic is, we're all not quite sure what to expect. Things will be okay. I want to just leave people with the hope that we will be okay. Already we're seeing signs of things getting better. People are slowly going back to work. There's less hospitalization. So we will get through this. We absolutely will get through this. Please stay connected with your loved ones. Reach out to other people, co-workers, and don't forget to also let other people help you. Thank you.
Thank you. If you want to reach out, or if you have topics you'd like me to cover, you can reach me at Metheny, that's EMETHENY, at radio-1.com. Thank you for listening, and please join me again next week. Until then, have a great week.
Radio Now 100.9's Indy Connection with Emily Metheny.